Harshbarger, and I'm the owner and pharmacist of Custom Compounding Centers here in Kingsport, Tennessee. And we've been compounding bioidentical hormone replacement therapy for nearly 25 years. We were compounding it before anyone in the area really knew what natural hormone replacement therapy was. Bio means life, and identical means that these hormones are identical to what the hormones that a man or a woman makes on their own. We've educated patients and healthcare professionals about the science behind these bioidentical hormone replacement therapies and how we compound these hormones. We compound the dosages to fit the patient's needs, and we can do that because of our PCAB accredited facility that we have here in Kingsport and in Johnson City. We can compound the bioidentical hormone replacement therapy in a topical dosage form, like a drop or a cream, as well as an oral time-release capsule. We can do pellets, or we can do injectable forms, and that can be done for men as well as women.
I'm Dr. Tom Rogers. I'm a medical doctor here in Kingsport, Tennessee. I've been doing bioidentical hormone therapy for patients for years. I work with custom compounding exclusively. Through the years, I've learned so much with Bob and Diana about hormones, and feel like I'm kind of the resident expert on them now. The difference between a natural or a bioidentical hormone and the synthetic hormones like night and day. Everybody got scared off of synthetic hormones about 4 years ago when the study came out that showed there was a slight increased risk of breast cancer and heart disease and stroke with synthetic hormones. It was a small increase and it was a bad study, but it still highlighted the differences between natural and synthetic. For example, synthetic hormones like Premarin are made from pregnant horse urine. When we say natural or bioidentical hormones, we're talking about they make them from plants. They're identical to what your body put out like it was supposed to anyway. We know a few things about hormones. Somebody asks me every day, do I need hormones as I age? And they're usually from 40 to 65, 70 years old. And I tell them, you don't have to have them, but we know a couple things. As your hormone levels decline, you decline in almost every way. It's not just your sex life. It's your bones, your brain, your skin, your vitality. So it's very important. You don't really have to have them, but we know they decline. We know you get brittle and you age faster without hormones. It's almost like nature's way of saying, you know, you're through reproducing, see you start dying. The problem is we're living a long time. So if you want to live that last half or third of your life without hormones, you're going to suffer the consequences.
I developed diabetes, and I was really concerned about my diet, so I bought a book that told me that natural hormones were much better for you than artificial hormones. And so I started looking in the area to try to find someone who dealt with natural hormones. And my husband and I talked about it, and he wanted to check into hormones for himself because he was feeling really tired. I was feeling really tired. I wasn't sleeping well. I never had a hot flash. I was really lucky on that. But I was feeling very, very tired, and when I woke up, I was tired, even though I slept a full night. I was losing my mind. I couldn't remember things, and that's not very good. And also, I had lost my mojo. I love my husband very much, but I just didn't have any oomph anymore. So they told me about Diana, and I came over to see Diana. And we sat down and talked, and she told me that all those things that were going on with me were perfectly normal. And I just went, ah.
Now, women, you know, when you hear the term estrogen, you think, well, that's one. No, your body makes 3 different estrogens. There's an estriol, an estradiol, and an estrone. You also make progesterone, testosterone, DHEA, and we can take those hormones and customize them to fit your individual needs. And we can do that for men. Men, you know, they get a testosterone level checked, but they also need estrogen levels checked because there is a conversion factor there. You know, we assess all that when we look at your individual dosage forms, and then we can recommend a starting dose to talk to your physician about and get you started with these things.
I'm often asked, what age do you need to start checking your hormone levels? Basically, whenever you start getting symptoms, usually it's around 40 years of age. I love to get a baseline testosterone on men at 40. And women, when they start getting tired, if they get hot flashes, if they get moody, they have vaginal dryness, they have decreased sex drive, they're gaining abdominal fat and losing muscle, their thinking's not as clear, their memory's not as good, let's start checking their hormones. For men, the typical man that comes in, he's middle-aged, meaning 40 to 50 years old. He's gaining belly fat. He's not as strong as he used to be. He's lost that competitive edge. Most people think he's just depressed, but basically that guy does not have a Prozac deficiency. He usually has a testosterone deficiency. His libido may be down. He may have erectile dysfunction. His bones are getting soft. He just doesn't care as much. He comes home, lays on the couch, gets fat, doesn't move. A lot of times that's a testosterone deficiency.
My husband started also going and getting testosterone shots because of his sluggishness and some of his symptoms. And I was scared to death that he was going to get really frisky and then I would be there going, So Diana told me that these would really help me, and I started on the natural hormones. And we're like teenagers now. We're a very happy couple.
We treat ladies from their 20s to their 70s, and we treat men as well, because men go through andropause like women go through menopause. Some of the symptoms that women may see are hot flashes, night sweats, irritability, anxiousness, panicky feelings, sleeplessness, joint aches. They may be fatigued beyond control. You know, they just don't feel like they used to. You know, things they used to enjoy doing, well, they could care less if they do it. You know, when you lose your mojo, you know that you've lost your mojo. And that applies to men and women. And we can help with that with the different therapies we offer. We work with any health care provider to help with that, okay? Don't feel embarrassed, don't feel ashamed. You come talk to us, and we'll create a therapy regimen, get it approved through your health care provider, and we'll go from there.